Again, that is for USFD audit observation in a pharmaceutical manufacturing unit and responses. That is my 32 years experience in US, Europe, Vietnam and India will surely help you in this video. Please follow the each and every points. So, number one, observation. You modified your validated parameters on approximately this associated with your stopper washing process. So stopper washing process, this is the topic. You have no documentation supporting that you assisted the risks of this process change before it was implemented. So minorly, that is, you follow this one. Specifically, you did not verify that modifying the pressure to pounds per pound per square inch, or use of a load versus a load does not adversely affect this process. So point to point you just follow. Your quality side director stated you would open an investigation on dated on these, assess the risks of this event. So you just notice 3 points here. How to respond such cases? So deviation initiated, investigation done, and training imparted to all concerned. So I think you follow this one, right? Then observation 2. Dated on this, you open an investigation initiated from mold recovered from a settle plate on line in your grade A area. Just imagine, you visually observe apparent product residue on the underside of the tray bed. This product residue was sampled and yield 11 CFU of mold. You made no documentation attempt to identify this residue nor how or when this residue was deposited. You identified apparent product residue in this same area, again dated on this. So follow this, each and every point are important. Whatever these are the USFD observation, they are very they're qualified, and that is vast experience. They know when they enter in the manufacturing unit, mean they know that is where to hit, where the problem lies. Response: deviation initiated, investigation done, and training imparted to all concerned. You just follow the responses. That is the way, this is the way they have to respond to the USFDA auditor. That is so that your next time, that is your manufacturing unit get the clearance. Third observation, dated on this, you discovered information resulting in a potential data integrity event associated with an in-process audit per PR ID number. This auditor performed visual inspection operating affecting approximately lots manufacturing from these through this. So this type of, that is observation, the data integrity is there. Data integrity is the most critical and unhealthy situation, that is, this is the biggest mistake, and this is that is not a good practice. It's dangerous. So how to respond? Deviation initiated, investigation done, and training imparted to all concerned. Training, they are specifying training, they are tracing this point again and again to the companies QA department, training department give the training properly to the respective department. This is the one of the most important point in pharmaceutical company. Training, scheduled training, not like that is irregular training. Your training has to be scheduled, documented, in what topic, which date, who has given, how many that is present there, their signature, like that. Then fourth observation, on dated on, you discovered a cracked needle hub, critical A defect. These are the defect is considered critical A defect, considered cracked needle, dangerous. Your while performing a manufacturing quality audit of product this injectable, definitely USP lot number this, you did not submit a file alert report. Such incidents, keep in mind, there are many people don't know that when you will find such type of cases, cracked needle, so you have to immediately, that is alert, fill alert report, that is FAR. For this event unit number this. So this is a critical A defect. So this is there is no excuses. This is mean such type of case is a disaster. Response, field alert report submitted, this is called FAR, and risk assessment done. SOP is revised to include the statement FAR to be submitted within 3 business days. So this is normally for any type of investigation, US FDA auditor is giving at least 3 days for response, proper response. So how to respond? You should know. If your company don't have any such kind of experienced key people to, that is response to the, that is USFD auditor observation response, you should hire a very qualified experienced consultant. This is not a joke, you have to take it very seriously. So there are many few people know that is how to write the response to the point with facts and figures. Don't hide anything. Okay. Then fifth observation. While reviewing smoke study conducted in room number these for lipolyzer, the following deficiencies were noted. See the situation. Prior to unloading of the HEPA cart containing partially stoppered vials, see the situation. Partially, that is stoppered vials. An operator was observed checking the tray number using forceps. Tray check performance gives the operator an opportunity to be close to the partially stoppered vials. The action provides possible contamination of the partially stoppered vial. So for injectable, you know that the injectable is very critical, and there is a high chance of contamination. So we should be very careful. So take care, very careful. Such type of cases are very that is critical. You have to, such type of cases, when you will face such type of problem, you will take action immediately, so without any further delay. So such type of cases, that is how to respond. You have to respond logically to the point. Assessment, you have to understand the gravity of the your problems and accordingly justify and logically reply. Assessment done and deviation recorded. Instructions are displayed to avoid to reoccurrence. Training imparted to all concerned. There are 3 things you have to do such cases. You have to do the assessment very deeply, thoroughly, and deviation. You have to ask for the deviation. And instruction as displays to avoid occurrence. So outside the department or inside the department, you have to put the flow chart and flow chart that everybody can understand quickly. So flowchart is a very conveying medium, So even there are many people operator level, they are not so qualified normally. So if you write in details, sometimes it is very difficult for them to understand. For that, you can describe this in a flowchart, so they anyone can understand. It is easier for them anyone to understand. So you understand, such a critical case, this is a crack in the needle. This is dangerous. Contamination also sometimes that is open, that is stoppered open vial. This is quite natural. If the that is stopper is open in the vials, not closed properly, this is quite obvious. The your product get contaminated. Even this is a injectable. There is no compromise for the injectables are is highly risk factors are there. How to respond? I already explained. Assessment done and deviation recorded. Instructions are displayed to avoid reoccurrence. Training imparted to all concerned. So in which what type of you have to understand, that is what type of your problem is this, and how you have to reply, what are the documents you have to rectify, what the training, where the training is required, to whom you will give the training, what type of flow chart you have to rectify and put immediately, explain to the operator supervisor and display on the notice board immediately to understand in the easily and in the better way. That is so the, follow my instructions, you can change your life, you can shape your professional life. Thank you very much.